Welcome back to the fifth video in this video series about the NCSBN's clinical judgment model, where we explore the 6 cognitive skills and how they apply to the clinical application on the NCLEX exam. In this particular case scenario, we're going to still follow our patient and look at items number 5 of the clinical judgment model that goes into take action. So this is kind of the implementation phase of the nursing process. Let's go ahead and take a look at our question right here. We are at item number 5. We're still caring for the 62-year-old client in the emergency department that we're suspecting of having or that is experiencing an ischemic stroke. So now it goes into medication question. So the nurse receives an order for tissue plasminogen activator or TPA. Which of the following actions are appropriate prior to administration? So now we're required to answer some questions about pharmacology, and it's a select all that apply. So now it goes into asking the client's caretaker about history of recent surgery or trauma. Well, most definitely we're going to need to do that because this TPA medication is going to dissolve any kind of clot that might be going on in the patient. Maintaining a blood pressure of less or equal to 185 over 110, and that is definitely also contraindicated for TPA. So we have to ensure that the patient's blood pressure meets this criteria because otherwise the medication is contraindicated because of a risk for intracranial hemorrhage. Now, it says also plan to initiate subcutaneous heparin immediately after TPA infusion is complete. We are going to initiate heparin therapy, but not until 24 or 48 hours after the TPA has been complete because, again, of the high risk for bleeding. Review the client's current home medication list, also very important to do to determine what other anticoagulants that they might be on or antiplatelets that might interfere with the administration of the TPA. And then again, verify the exact time the stroke symptoms started because we know that the TPA can only be administered within a 3 or 4.5 hour time frame. It depends on the type of facility that you're working with. And so again, over here, we get the explanation as what are thrombolytics, why the correct answers are right, why option 3 is wrong. And this applies to the physiological adaptation category of the NCSBN's client's needs. So now we've accomplished number 5 of the 6 cognitive skills. Please check back in the next video to where we go into finishing this case study and explore the 6th cognitive skill. Thanks for watching, and we'll see you in the next video.